Since going live with Mint, we have been able to really receive invoices on time and process them on time and also accurately, because we can see what has been received and also approve the right quantity, the right way, and nothing has been lost in transmission. My name is Theo Rukundo. I'm the Director of Pharmacy Supply Chain and Contracting at Boston Medical Center here in Boston. I've been with Boston Medical Center for a little over 3 years now. Oversee a team of about 25 FTEs supporting acute care, ambulatory care, retail pharmacy, specialty pharmacy, and mail order pharmacies. So when it comes to challenges we have faced, pharmacy supply chain operations, mostly when we interact with vendors, so receiving invoices, that was the biggest challenge we had. Mostly invoices can be lost in transfer, and when they get lost, then we face late fees attached to late payment, issues with reconciliation approvals. When Mint came around, we were able to not only get on-time transfer of those invoices, but also approving them on time so we can remit payment to our vendors. In the last few months, we were able to really meet our contractual obligations when it comes to remitting payments and also unlocking some discounts when we're paying on time. And that was really a game changer for us to remove those obstacles in our supply chain operations. As a nonprofit organization, Boston Medical Center really relies on cost containment to stay financially viable and to maintain our overall financial health. So those discounts really go directly to our bottom line to really help us meet our budget when it comes to cost containment. Mint really helped us not only achieve those goals, but also improve our vendor relations, because when we pay on time, our vendors are happy, we get our items on time, and we also provide adequate patient care. That's how we were able to really streamline those processes by leveraging the capabilities provided by TraceLink to achieve those goals. So not every vendor has capabilities to use the wholesaler. So some vendors will require direct purchase. In doing so, they have some shortcomings as well. They don't have the architecture needed to distribute or to use the proper channel to get the item to the customer. That architecture is enabled by Mint, that interconnectivity between the customer, who's us, the healthcare institution, and the vendor. By us getting the item on time, just in time for us to dispense it, we were able to really not only provide adequate customer service in terms of patient care, but also improve our connectivity with the vendor, and also our business transactions were smoother through Mint. Invoice management is complex in terms of how supply chain network is designed. So some vendors can get connected with the customer via EDI, electronic data interchange. That EDI can come in multiple forms, and not every vendor is enabled with EDI. So we might need an item that's distributed by this vendor, but the vendor might not have capabilities to really connect with us. That's when we leverage capabilities provided by TraceLink to really unlock that door that's closed to enable that connectivity in transferring those invoices to the customer, and the customer getting to approve them in the right system, and the account payable to receive them and make payment to the vendor. So that interconnectivity between the vendor and the customer enabled by TraceLink helped us really process those invoices, which were not a capability provided by the vendor. Since going live with Mint, we have been able to really receive invoices on time and process them on time and also accurately, because we can see what has been received and also approve the right quantity, the right way, and nothing has been lost in transmission. Also, by approving those invoices on time, we were able to meet our net payable obligations. So overall, the performance achieved through MINT was significant for us to achieve long-term goals, which are to stay on top of our budget, contain our costs, and also unlock some discounts.